Welcome everyone. I'm hoping that you're having a beautiful day or night. I want to go over something very important about how to adjust your own wrist, hands, and fingers. Now, first I want to stress to all of you that all of us have problems somewhere along the line of our wrist, hands, and fingers because of the fact we overuse it. We're typing, we're writing, we're texting, we're squeezing objects all day long, depending upon your occupation. But anything we do repetitively is going to pay a toll somewhere in life. Just like if you drive your tires for a long period of time, they're eventually going to wear out or become out of alignment. So with these joints can become out of alignment too. And when they're out of alignment, most people don't know, because if one area is not moving, something else will start to compensate for that. So the more, or you could say the longer something is not working, the higher percentage, the more symptoms you're eventually going to get over time. So the most important thing in any joint is motion. Motion equals function. When you are not having proper function, that means you are going to have some type of inflammatory change, or you're going to have some kind of pain. So let's start out the wrist. You have 2 rows of carpal bones, 8 bones. The area of the carpal bones, the scaphoid lunate, the trochantrum, this row, particularly right here, is called the proximal row. This is closest to us, to our elbow, coming in this way. The distal row means it's going furthest away. So whenever we spend a lot of our time in this position, typing or writing, and our wrist is cocked back, this area, particularly these joints, particularly on the thumb side, the scaphoid and lunate, these 2 joints right here become locked. They become locked going posterior this way. So what we want to do is just a general move. Take your thumb behind here and just grab it in there and just push like this. As you push, you're kind of cocking your wrist back, and a lot of you are going to hear clicks and pops, but don't worry about it. That's all I want you to do, just these 2 bones right here. Then you can come to the proximal area right here, and you can bend it like this, and you can just take your fingers as you bend it and push it in like that, just like this, go across. Because all these joints generally go anterior or go that way. So what we're doing here is we're just freeing up mobility. So now let's move to the metacarpals. We have 5 metacarpals, all right? And these are the metacarpals inside the hand. And generally what we're going to do here is we're just going to take the bone and glide it back and forth. We call it A to P glide, just like this. All right, and if you have adhesions in there, it's going to free up those adhesions. Now you can do it you can spend a minute doing it. It's okay. Just go back and forth. Okay, don't worry too much on the thumb, more these 4 fingers in the hand. And you will notice after doing it, you'll feel a whole lot of looseness in there, which is good. So let's look at the fingers right now. You have 4 fingers, 1 thumb. In each of these 4 fingers, you have 3 joints. In the thumb, you have 2 joints. Each joint should be working the same way. I'm going to go over one joint to give you an understanding of how each joint should be working. So in other words, when people crack their knuckles, what you're doing primarily is you're releasing nitrogen and carbon dioxide. You're not correcting nor doing anything, but just mobilizing and opening up the joint. This here is going to free up the joint. When I say free up, you're going to regain mobility. If we lack mobility in a joint, we eventually can develop arthritic changes, or actually pain and stiffness in the joint that can eventually get worse over time. So the first thing I want to mention to you, let's look at this joint right here in the middle, my middle finger, long axis, just long axis glide. If you hold it, just pull it like this. I just felt it release, you hear a little pop. Then we're going to go left and right lateral flexion. Okay, watch here, okay? I'll do it this way. You can just go left and right, just go back and forth, okay? Then you can go A to P glide. You could take it and just go back and forth like this, okay? And then you do left and right rotation, right above the joint, turn it back and forth to the right, then turn it back and forth to the left. So remember that what you did on one joint, you should be doing on all the joints. Okay, it's very important that you check all the joints, because this will help prevent a lot of problems in the future. Now what you're going to notice after, you're going to say, wow, I've never felt so good. You're going to feel the tingling. You're going to feel a sensation in there. Guess what? You're going to start texting again, writing, typing, driving. You're going to say, I can't believe how light my hands feel. That's what I'm looking for in the comments below. I want to know how well you did, because I know that you're going to want to share this video with others. That's what we want to do. We want to educate the world because everyone has problems. I really hope that this makes a big change in your health. I ask you to leave your comments below, and most important, make it a great day. I'm Dr. Alan Mandell.